We're here to officially launch both the new partnership we have with Barrington's MRI, it's called Bon Secours Diagnostic Imaging, and also to officially cut the ribbon on the new CT machine. So Bon Secours Diagnostic Imaging is a partnership with Barrington's MRI, the company that specialises in radiology diagnostics. And of course radiology being so important in terms of the early detection, the treatment of disease, and radiology is a key part of that. So we're delighted to be associated with Barrington's MRI, and that's the main reason we're here today.
Congratulate the Bon Secours for first of all expanding into Limerick here a while back, and I know that the rebranding has been underway for a period of time now. This hospital will probably always be known as Barrington's, and that's a nice thing as well, because the Barrington family have, particularly in East Limerick and in Limerick City, in a bygone they made a very significant contribution, and it's an important part of our heritage that we would remember that. This hospital had a tumultuous political history as well, as we all know, in the 1980s, but it is fantastic to see that it has continued to give important health care to the people of the Midwest, particularly in Limerick, and it has now found itself being reborn again with a relationship with the public hospitals as well, which is important because as a minister in the government, with the advent of sláinte care and what the Department of Health and the Minister had together with the HSE and the hospital groupings want to do, there will be a relationship which will have to continue to be forged between the public and the private sector. And that's why the importance of diagnostic imaging and the availability of that, and quick turnover, and the availability of the best equipment that's available, the best form of technology, and of course the personnel that are able to use it, will not be of just advantage to those that are working in the hospital environment, but also to the primary care environment, particularly to general practitioners. And I think that's very important, because if we are to see improvements in the healthcare system, it can't just be about pumping more and more money into it. We've never had more money being pumped into healthcare, but yet we still seem to have continued difficulties. So our work practices and how we do things and how the relationship is going to develop between public and private, between those who work in the services and between those who avail of the services, is going to have to change. We all have to be prepared to play our part in that. Politicians, practitioners, patients, advocates, and representative groups like the Sisters of the Bon Secours and everybody else as well.
What it means is that we're able to provide access directly from GPs in particular to our hospital here, where we provide a multitude of diagnostic radiology equipment, be it MRI, CT, ultrasound, X-ray, DEXA scan, OPG, etc., the full modalities, but all under the one roof, all under the one new brand, Bon Secours Diagnostic Imaging. But more importantly, it's also partnering with a company like Barrington's MRI that have the consultant radiologists that are all based here locally in Limerick, the radiographers, the nursing staff, the clerical staff, all providing all of that. So hopefully for the people in Limerick, it's providing speedier access. It's also an integrated system, so that the results that are available quite quickly in terms of turnaround are also available electronically back to the GPs in the area, as was mentioned in what's called HealthLink. And also in addition to that, our own consultants that we have here in the Bon Secours, who are all primarily surgeons who operate here, that they have also got access on the ground to the radiologists and radiographers at the same time. So it provides a fully integrated service that way. It's obviously with Sláinte Care that report has been commissioned, but more importantly, practically, we like to develop a relationship with UHL here in the region, who've got provided a fantastic service, to be fair, but some of their consultants also work with ourselves here in Limerick, and I think that partnership is important. And some of the patients that would come here we do elective procedures. We don't involve at this stage of our offering, our service offering, in the acute or emergency side. That all channels through UHL. So, and that puts considerable pressure on the resources of UHL. So if we could assist in any way in terms of the patient pathway, in terms of be it diagnostics or be it whatever, I think it's important that we would sit down with them first and foremost. And when you sit down with people, anything is possible. Ideas might come, or opportunities or initiatives, etc. And if the patients benefit, more importantly, in the middle of that, well, then we're here to assist that. So I think by there's nothing prescribed necessarily at the outset, but sitting down with them, and in fairness, thus far we've met with Ms. Clacone and Ms. Noni Spillane and Mr. Paul Burke, the clinical team outside, and they've been very, very supportive and very, very accommodating in looking at opportunities. So we look forward to developing those over the coming weeks and months with themselves here in Limerick. What we have at the moment is, as I said, I'm here now 14 months. So as I would say to the staff, we've got a kind of 3 phases at the moment. Phase 1 is stabilisation. We're stabilising what we currently have. When we acquired Barrington's early in 2017, there was some refurbishment works in terms of the infrastructure, new equipment, replacing equipment, etc. So that's all stabilising what we have infrastructure investment-wise. Part 2 then was also increasing what we currently do, increasing orthopaedics, increasing general surgery. All of that requires purchasing of equipment. As I said, thus far we spent over 2 million in that, as well as ICT systems. Just recently went live with a new hospital information system called IPIMS, which is the same system across the other Bon Secours sites. Back in July went live with that. Again, that was further hundreds of thousands of investment in that. Phase 3 then is the final phase in terms of opportunities to further expand and further develop new service offerings. But I think it's very important that before we do that and say that, we got to quality assure it, that we're able to provide that in the best quality possible and not look to go out and provide anything at all just for the sake of it. We really need to stabilise what we have, do more of what we currently do, and then look at opportunities. And that will come in terms of space. We're quite restricted here on George's Quay, but there's also maximisation of that space we have locally. As well as I said, looking at opportunities going forward, and if we can justify those and to the board and to the sisters of Bon Secours, they haven't been found wanting and supporting us in terms of that. So I think it's stabilisation, increase and expand. That's what our approach is, bit by bit.